So the main thing we want to start with first with this is essentially the history, which encompasses a number of medical things as well. So we want to know obviously the Socrates, the duration, and the duration and is that working? Yeah, the duration, timing, and onset of the symptoms. We want to know, are they rushing to the bathroom? Is it associated with incontinence? Is it on coughing or straining? We want to check that they're not taking any medications like calcium channel blockers, antihistamines, opioids, anticholinergics, which cause constipation, or alpha agonists, and that there's no and just to check with the history of OAB that there's no problems with the saddle anesthesia. And they always need to wear pads. The common differential here is UTI or cystitis. Do abdominal exam to see is that the issue. See if there's any nausea, vomiting, fever, backache, any signs of pyelonephritis, any other symptoms, straining, incomplete emptying, or maneuvers to empty the bladder, which are common in bladder emptying techniques. So basically, overactive triggery bladder and urinary tract infections of cystitis. Also, there's pelvic organ prolapse, which you put in here, and that is when there's incontinence on sneezing, coughing, or bearing down. So that's stress urinary incontinence. Pelvic organ prolapse, it feels like there's something falling down, and there's effect on sexual dysfunction. So now we have overactive bladder, UTI/cystitis/pyelonephritis, POP and SUI, and also check for vaginal discharge, STIs, and new partners. In the background, look for obstetrics and gynecology, and look for BMI, look for chest exam in terms of coughing, abdominal exam and pressure, consider a P-aorta exam for anal tone, and consider a pelvic exam as well. That's your examination. And for your background medical history, think about activities of daily living like lifting, diabetes, respiratory disease, connective tissue disorders, and gynecology and obstetrics. So check for any POP questionnaire, check for any cystocele or rectocele, and the anatomy of the avulsor or vector lani. So obviously treating UTIs for overactive bladder, you can use specific training. For pelvic organ prolapse, there's specific shorts. You can use a bladder diary. Only treat recurrent UTI if it's greater than twice a year. Cut down on caffeine and alcohol and enforce lifestyle factors like weight loss. If hematuria, obviously send a dipstick and consider vaginal bleeding. Have a big lifestyle discussion and give pelvic floor exercises as well. Management includes a pessary, urodynamic studies, a colorectal exam, or consideration for surgery.